Well, we're going to go ahead and get started. Thank you all for joining us. My name is Tamya Cox-Touré, and I am the Executive Director of the ACLU of Oklahoma. I have with me my colleagues Emily Wells from Planned Parenthood Great Plains and Rebecca Tong from Trust Women. And we're here as a collective organizations that have been fighting anti-abortion bills in Oklahoma for a while now. It is no surprise that this session is one of the most recent sessions where we've had such the sheer volume of anti-abortion bills that we have seen. This is a little bit different in the sense of almost 20 anti-abortion bills have been filed or they're carried over from last year that are extreme in nature. No surprise because of the recent decisions from the US Supreme Court regarding Texas, and even having a decision around the Mississippi case coming down maybe as early as June. It is no surprise that Oklahoma is seeing copycat bills. Collectively, we think of all the bills, regardless of the topic of these anti-abortion bills, as extreme in nature and dangerous and harmful to access to abortion in Oklahoma. We recognize that Oklahoma has been a state that has attempted to ban abortion in numerous ways. However, we also know that Oklahoma has been a state that has fought back in the sense that many of the bills that have been filed and signed into law have been challenged and have been struck down as unconstitutional, or in most recently have been temporarily halted, as in the case from the bills from last session that were signed into law have all been halted. But in with the recent Supreme Court cases, we are seeing extreme bills that will have a true impact, as well as just quite frankly, just naming that we also recognize with the potential of Roe being either overturned or severely diminished. We know that access to abortion in Oklahoma could be threatened. We also recognize that in the moment that we are in, Oklahoma is in a different position in the sense of seeing Texas patients. So Oklahoma is really vital to abortion access in the region, and my colleagues will talk more about what they're seeing in their healthcare, within their healthcare facilities. The ACLU of Oklahoma, Planned Parenthood, and Trust Women will continue to fight at the Capitol, at the Oklahoma legislature, against all of the anti-abortion bills. We recognize that all of them are extreme, and we will continue to highlight the importance of abortion access in Oklahoma, but most importantly, that Oklahomans will get the basic health care that they need and deserve, and that includes abortion access. So I will turn this over to my colleague, Rebecca Tong, if she wants to talk about her work and the work of Trust Women.
Thank you so much, Tamya. Yeah, I'm incredibly saddened by what the legislature is wanting to do to Oklahomans. They deserve better, and that's why we're here today, to demand better for Oklahomans. On August 31st of last year, the phones in our Oklahoma City clinic started to ring. And in the 6 months since that day, our phones have not stopped ringing. Texas's SB 8 legislation was a shock to an already fragile and overstrained system. The stories and images that have come out of dozens of news pieces haven't been enough to turn back this unprecedented and intentionally created health crisis. We have hosted more than a dozen journalists at both of our clinics in Oklahoma City and in Wichita, representing media outlets in the region and around the world. And our honest hope was that if the general public knew the reality of abortion care in America, the extraordinary compassion and kindness of our providers and our staff, and the extreme efforts that our patients have had to go through, traveling hundreds of miles to receive constitutionally protected health care, a pill. It has not been enough to turn back this course, and it's not been enough to roll back the state-sponsored brutality that is in Texas's SB 8. Months have passed, SB 8 still stands, And I want you all to keep in mind that nothing has happened to Roe yet, right? Roe still stands, and this is what access looks like in this part of the country. We have been told that the future of abortion in America is unsettled, and the Supreme Court definitely has Roe in its crosshairs, and that we should expect to lose the right to abortion before the summer is over. And it's easy to look around and believe that we're looking towards what many people are calling a post-Roe world. And we have also seen the incredible response from activists, organizers, providers, and citizens in the face of wave after wave of anti-abortion legislation. Americans of all political persuasions and social backgrounds understand and want to keep abortion legal and accessible. Already in so many of our communities, this care is inaccessible, even in hospitals, right? Even in major cities like Oklahoma City and Texas. And this is where independent clinics like Trust Women's are a special place offering this care. And they're often targeted by anti-abortion advocates who are bringing them conflict and violence. When these draconian laws are passed, they impact abortion providers and especially independent clinics. Since 2016, over 110 independent providers have shut down their doors. And many times, only 1 or 2 clinics remain in the entire state. And because of the punitive, medically unnecessary restrictions that we're seeing passed, it's incredibly difficult to open up an abortion providing facility. And when these clinics close, they often do not come back. The scope of what we're seeing right now is immense. Texas is the second largest state in our nation by population. It's located squarely in a geographic corridor where access to abortion has been chipped away for decades. And we know that without access, there is no real choice. Every state that surrounds Texas already only has a handful of clinics. Consider Oklahoma, with a population of over 4 million people, over half of whom identify as female, right? There are 3 clinics that provide abortions in the entire state. And Trust Women is one of the only ones that provides this care up to the full legal limit, 21 weeks and 6 days. That's 3 clinics for 2 million people already. And now we add on the population of Texas because their state has abandoned their residents, right? They did not ban abortion, they simply outsourced it. And so in response to Texas's malicious negligence, now we're seeing Oklahoma legislators put forth dozens of anti-abortion bills to match the cruelty of Texas's SB 8. And these bills are aimed at providers, at healthcare workers, at families that are seeking this essential medical care in the communities. Bills that would make, educational partnerships illegal between abortion providers. Bills that require copycat bills, rather, that are just like Texas's SB 8, that again have nothing to do with medicine. The variety of bills that chip away at access or that are attempting to outright ban abortion without exception. This is what we're seeing, and this is a glimpse into our future. I also want to just briefly bring up here in Oklahoma, a young Indigenous woman named Brittany Poolaw is still in jail, convicted of manslaughter last October for a miscarriage. And a 2013 study from National Advocates for Pregnant Women showed a significant increase in the arrest of pregnant people accused of harming their fetuses between 2006 and 2020. The study found that nearly 1,300 people were arrested, a number more than triple the preceding 22 years. So what I would like to ask of Oklahoma lawmakers is if they would like, we've often heard that lawmakers can be moved to act on an issue with just a dozen phone calls from their constituents. I wonder how true that is. Our phones have not stopped ringing in 6 months. We're being forced to turn people away in desperate situations. And if they would like more input on these abortion laws, they're more than welcome to office out of our clinic for a few days and to hear what people are going through right now. And I would like to turn it over to my colleague, Emily Wales with Planned Parenthood Great Plains.
Thank you, Rebecca. I appreciate that. Good morning, everyone. I'm Emily Wales, the interim president and CEO of Planned Parenthood Great Plains. We provide care to patients in Oklahoma, in Arkansas, Kansas, and Missouri. Here in Oklahoma, we have health centers that provide abortion care in Oklahoma City and Tulsa, and we have another center in Edmond. We have known for years that sexual and reproductive health care, and particularly abortion, is regional. While this care should be accessible to all who need it, abortion access at the local level is not a reality for many people in this country. Much like Rebecca shared for Trust Women, PPGP is serving patients who are fleeing their homes to seek care. These are medical refugees, forced to drive hours from home, often leaving early in the morning to make appointments on time, and scrambling to make travel and childcare arrangements. While some patients can get care despite these obstacles, we know that's not true for everyone. The bills currently pending in the legislature are not intended to make care safer. Whether it's assigning a tracking number to individuals seeking an abortion or banning care at 30 days after the start of a person's last menstrual cycle, a proposed law even more extreme than Texas's Senate Bill 8. Politicians are directly interfering in the relationship between a medical provider and their patient. And the intent is clear: to shame and intimidate people for accessing a safe and essential medical procedure, and to punish the doctors that provide that care. Rather than demeaning the people they represent, lawmakers should focus on expanding care and protecting the health of Oklahomans. The Texas law has intensified the crisis in access to care, and Oklahoma has been on the front lines, serving as a medical refuge. Our providers, like those at Trust Women, are hearing and seeing exactly what desperation looks like. It is personal, it is heartbreaking, and it's happening every single day in our centers. Many of those patients have gone to our Oklahoma centers from Texas because they are carefully calculating the number of hours they'll miss at work and the time they're expected back to pick up their kids from school. For these patients, every minute matters. For those who can't make the trip, they're forced to either carry a pregnancy against their will or attempt to end their pregnancy without medical support. Should Oklahoma ban nearly all abortions, it will join with Texas in becoming a state where its residents have fewer constitutional rights than their neighbors. If Oklahoma deprives people of making fundamental decisions about their own health and lives, a system that's already pushed to the max will break. Right now, the shortage of abortion providers means that some Oklahomans are forced to seek care in neighboring states, such as Kansas, where a statewide vote this summer could strip protections for abortion, and that may decide the long-term access to care across the region, while Roe hangs in the balance. We're closely monitoring the proposed anti-abortion and reproductive health bills you've heard about today here in Oklahoma. And we'll do all we can to share with legislators and the public the very real effects of politicizing healthcare. Planned Parenthood Great Plains will do what we've always done here in Oklahoma. We will fight for our patients and our communities and continue to provide abortion and other essential healthcare to those who need us most as long as we can. With that, I will turn it back to Tamya to do some Q&A.
Thank you both, Rebecca and Emily, and appreciate the work. We do have a couple of questions, and for those, again, if you do have questions, please put in the Q&A and we will do our best to direct them. The first question is from AP reporter Sean Murphy. He asked, do we have a list of these anti-abortion bills that we could share? We definitely have a list that we will get to you, Sean. It's just important to recognize that these bills are ranging from introducing a constitutional amendment that would provide essentially personhood rights to fetuses, to as well as Senator Treat has a constitutional amendment that would but would say that there's not a right to an abortion in Oklahoma's constitution, all the way to the extreme, which we believe all are extreme, to criminalizing and making it a felon for anyone who performed or obtained an abortion from Senator Hamilton. very similar to bills that we've seen introduced in the past that essentially will create a first-degree murder charge for anyone obtaining or performing an abortion. The next question, Emily or Rebecca, please take is, do you have any statistics yet to quantify the increase in abortions performed in Oklahoma following the passage of Texas SB 8? And I will give it to either one of you to take.
Yeah, I do. We do have a few statistics. Some of this data is still being collected, but in Oklahoma, our clinic went from seeing 12 patients from Texas in August to 130 in September. And we saw a similar increase in out-of-state patients in Wichita. So it is a ripple effect. And it is because Texas is such a large state. I think we'll continue to see how that plays out. What we do know is that everyone is being delayed at least 2 weeks. And that leads to later pregnancies, more complications, more surgicals, and just riskier healthcare because they've been forced to wait.
Yeah, I'll echo that for us as well. I think, there are some numbers that came out of Texas this week showing a significant decrease, and we've had some questions about whether we're surprised that Texas is seeing fewer patients. The answer is no, because we, like Trust Women, went from seeing about 50 patients in the fall of 2020 to over 1,000 in 2021 from Texas seeking abortion care in our 4 states. The majority of those folks, of course, are going to Oklahoma because it is the closest option for them. And the reality really is that people are calculating just how much time they can be away from their kids and their work. It's not an option for them in many cases to get on a plane and go somewhere farther. I would say too, the statistics in this area are really hard. We're learning more. I know there are some organizations in Texas trying to track this, but what we can't get good information on are the patients who don't get care at all or attempt to get care without medical support and feel as though they can't consult with a medical professional about that care. That's not a situation that patients should ever have to face.
Thank you both. The next question is, should Roe fall and abortion care be banned in Oklahoma? What are each of your organization's game plans? How would you be able to help patients, if at all? And real quickly, obviously the ACLU of Oklahoma is not a healthcare provider. However, I think it's really important to note is that we know that if Roe were to fall and then Oklahoma's trigger law goes into effect, it would only ban, known abortions. We know that when Oklahomans need or access an abortion, they will find the means to do that. So that will be essentially, as Rebecca said beautifully, like outsourcing, and Oklahomans will travel farther than they have to as right now. I also serve as chair of the Oklahoma Call for Reproductive Justice, which is our reproductive justice organization in Oklahoma. And we are committed to also ensuring that Oklahomans get the access they need by essentially reaching out to other health providers in other states, as well as providing the travel costs and needs that we know will increase. However, we also just recognize even more so now that access to abortion is through a regional lens, and we'll need to essentially go to other states, which is unfortunate for Oklahoma. But Emily, if you want to take that about what would be the game plan of Planned Parenthood and how will you continue to help patients?
Sure. So I think there are 2 critical things that come to mind. One is the wraparound support that Tamya mentioned. So we've had to dramatically change, like most abortion providers, what our work looks like because of Texas losing access to the majority of abortion care. So previously, we of course supported patients, we helped provide some financial resources, but now we are doing a different model where we actually have a version of case managers who help patients figure out state restrictions, gas cards, hotel support, because care is no longer just getting to a provider, it is fleeing your home, it's potentially taking your children and being off of work for days. So we're providing that immediate wraparound support. And then separately, as I mentioned, care is regional. And we have seen what happens when a state loses access. It's not that abortion goes away, it's that those patients are forced to flee and find other locations for care. In Kansas, there's a state level constitutional protection that does provide for some additional protections if Roe is to fall. It's critical. But there is a battle in that state as well to ensure that Kansans can continue to access care that is safe and legal and necessary. So we'll be fighting on regional fronts and also working directly with patients to support them in a very challenging new world.
And Rebecca, do you want to add anything to that?
Similar steps that we're taking to Planned Parenthood's working to change some of our clinical in-clinic procedures so that we can assist patients as best we can in getting out of the state if necessary. And then I think, as a coalition of organizations that care very deeply about this, we will work to re-legalize abortion, right? We will be fighting this in the courts, and most likely in the state courts. So this is not a foregone conclusion, but there is a lot of difficult work ahead of us.
And I think that's such a great point, that even with the decision potentially coming down in June, that there will be additional lawsuits happening. So we will continue to be optimistic that care will still be provided. And just a real quick follow-up. What are the next closest geographical options for folks who have to travel? And I will just say real quickly, and please add on, is that for us, it really will depend on if other states have trigger laws and going into effect. Absent trigger laws, and abortion being banned in Oklahoma, absent those potentials, it's right now it's Kansas and Colorado and New Mexico. I believe Arkansas has a trigger law currently right now. So if Roe were to fall, that would not be an option. But as of right now, we know what regions people can go to because of where Texas is going. We also know that if Roe were to fall and abortions are banned or Roe is overturned, we also know almost half the states in this country would ban abortion, either through pre-Roe laws that are on the books or through trigger bans that we've seen in Oklahoma. So access would be limited, specifically to the coast. However, we also know that most states would continue to fight to ensure access would continue. We do have some more questions. Can you speak on how extreme bills will affect all people in Oklahoma? Does Emily or Rebecca, do you want to take that one?
You got it, Rebecca.
I was just going to say, I know that there is, there's basically a pregnancy registration law that they're trying to pass. And that is the first step towards, they already want to criminalize birth control, right? And abortion is a form of birth control. Their next step will be to get rid of other forms of birth control and to criminalize pregnancy, especially for, what our society calls quote unquote bad women, right? Those are the people who are going to be hurt by these laws. Women of color, Indigenous women, women where English is not their first language. These laws make it incredibly difficult, not only for them to access abortion care, but also just basic reproductive health care. The number one reason that people come to our clinics is because they would like to be good parents. They are already parents, most of them. They want to be good moms, and they want to be able to take care of the children that they already have. And none of these laws are pro-family. None of these laws make it easier for our patients to build and grow a family successfully. That's what they should be concentrating on instead.
And real quickly, just to add, is that we know that all abortion restrictions, even in the past and currently, are inherently racist. And so the disparate impact that abortion restrictions and abortion bans have on Black and brown bodies will continue, in the sense that those who have means will be able to travel to other states, and those without means will continue a forced pregnancy. And we continue to ensure that we really see these abortion bans for the ACLU of Oklahoma through a racial justice lens. And that is the impact that these abortion bans, it continues to pit Oklahomans that have means against Oklahomans that don't have means. And the Oklahoma legislature should be better, and Oklahomans deserve better of an Oklahoma legislature that continues to uphold the white supremacy laws that abortion bans continue to track. That's one way that I think that these extreme bills will affect people in Oklahoma. I see one more question from the Washington Post. Of all the anti-abortion bills that have surfaced in the Oklahoma legislature this session, which are you most concerned about? Emily, do you want to take that one first?
Sure. It's probably not a fair answer to say all of them, but they're all scary for very different reasons. I think the Texas copycat bills are very concerning because we've seen that they're in effect in Texas, right? That court intervention is no longer a backstop to ensuring access to care, and that legislators can't pass extreme things for political gain and then rely on courts potentially to intervene and preserve constitutional rights. So we're concerned about that. We're certainly concerned about a 30-day ban, which is even more extreme than Texas, clearly emboldened to this, race to the most extreme option. And then I think, Rebecca mentioned the patient registration piece. It should be deeply concerning to people that the legislature wants care that should be between you and your physician to now have direct state tracking of individual patients to ensure that they, are followed by the state legislature and state agencies. That should feel like a violation of rights because it is. So each one of these things we know is designed, I think, in many ways to get headlines. But for us as providers, there are real lives that will be impacted. There are real people who will be tracked or prevented from getting care. All of them are very, very problematic when it comes to actually accessing or potentially ending care in this area.
Rebecca, do you want to, do you have anything to add? Me neither. Good job. I believe that is all the questions. We'll be around for one more minute if there are any other questions that people would like to put in the Q&A. So we'll give it about 30 seconds.
I'll say one thing while folks are thinking of questions that hopefully Rebecca will take. So I think when we talk about access being regional, that's been a reality for a long time. And we as providers and advocates know that. But there are patients right now for whom Tulsa is too far. So Oklahoma City is a preferred option, but when we attempt to talk to them about options in Tulsa, Wichita, Kansas City, those are barriers that prevent them from accessing care. So when we eliminate local options and say, okay, now we're looking at Illinois or New Mexico, that will not be feasible to some patients. That is not a scary threat or an attempt to make this seem like a dangerous outcome. Those are real outcomes that are happening now. There are some patients who are telling us, I can't do that. I can't get the extra hour and a half or 2 hours to Tulsa. I certainly can't get to another state. I think as much as we care about regional access, and we do, and I think Kansas's unique protections mean that it will be a critical point of access in the future if Roe's overturned, but we will not stop fighting for access at the local level, because everything that Rebecca and Tamya have said about the patients who stand to lose care, that will be very real for those folks.
Thank you. And we do actually have a few more questions that have popped up. And just to clarify, I think a question earlier was how many health providers, and I believe there are 4 in Oklahoma. There are 4 in Oklahoma. And while I am finding these questions, could everyone please state their pronouns? My pronouns are she, hers.
She, her.
She, her.
Perfect. One question that we received is, currently, what is the current wait time for patients to get an abortion?
Previous to SB 8, we would have scheduled people same week. Now people are waiting at least 2 weeks to get an appointment. And that depends on our availability. We have increased the number of physicians that we have on staff, as well as the number of days that we're providing care in order to help more people access this desperately needed healthcare. And so I believe in Oklahoma, we're about 40% busier than normal times, which it's not been normal for a very long time now. And like Emily said earlier, this is just the people that we can see. This does not at all quantify the people who are being turned away.
We're in the same position. I think in Oklahoma right now, depending on availability, there are weeks where we are 3 or even 4 weeks booked out, which is a really long time when you're waiting to get care. And so we are seeing some numbers of Oklahomans, as I think Rebecca mentioned too, going to Kansas, not because they don't have, in theory, local care, but because it's not accessible due to the shortage of providers, really.
And I also think about this as an ecosystem in the sense of all the many abortion restrictions that Oklahoma has already passed and that are already playing and that are already into law. This just, adds on top of all the, obstacles Oklahomans currently have to seek an abortion. One other question that we have is, do you have any reason to suspect more abortion bans will lead to more people seeking sterilization? Rebecca or Emily, do you want to take that?
I think it's really hard for us to know what the long-term effects will be. And for many patients, the need for abortion care is not something that you anticipate or plan. And so by the time it becomes an issue, you are looking for care immediately. I wouldn't be surprised if we see impacts like that. It's certainly true that our patients from Texas now are sharing with us that they're confused and wondering why they have fewer constitutional rights than their neighbors. That's a thing we've heard from patients. Why is it that the laws in Texas are more extreme? So I think it is certainly starting to enter people's minds that they have to think differently about their futures depending on where they live.
The additional question is, what action are you looking for in the immediate future from lawmakers and or the reproductive justice movement? For the ACLU, I think the actions simply are that we uphold the constitutional values that's still in place. As of right now, Roe is still in effect. And so to continue to pass these very dangerous and harmful bills, is not the road that I believe Oklahoman legislators should be going down. But from the reproductive justice movement as well, is like we continue to speak out against these measures, to talk about the true impact that bills like this have on Oklahomans. And we just continue to want to ensure that we amplify the voices of people that are getting abortions. We do this without judgment or shame, and we expect that from the same of our lawmakers, which unfortunately just is not happening around abortion access, unfortunately. We truly believe that abortion access and abortion care is simple health care. And we know that we don't make these same type of decisions and go through the same obstacles when accessing any other healthcare decisions. And hopefully soon that lawmakers will respect the private decisions of Oklahomans. And that's what our expectation and what we would hope for the future. But action continues to look like calling your legislator, lifting up your voices, writing op-eds. Our goal is hoping destigmatizing abortion, normalizing that 1 in 4, women will have an abortion in their lifetime, of reproductive age will have an abortion in their lifetime in this country. And the ACLU, as well as I'm sure all of our organizations in this work, really want to destigmatize everything around abortion. And we know that abortion is part of basic health care. Does anyone else want to take that, add on to that?
I'll say only my request of legislators certainly would be respect the Constitution and the individual rights of the citizens you represent, but also think about these people as people. The patients we're seeing are individual people. And it is one thing to pass a law in a state capital that feels far removed. And it's another thing to be the provider who is telling a patient, you do not have the same rights you had before. They are fewer now, or they're fewer than someone in a neighboring state. We're having those conversations. So the impact of these laws is very, very real to us.
The only thing that I was going to add is that, yeah, lawmakers could pass a law right now to protect this. They could pass a law that affirms this right, affirms this private medical right, and they are not. And I don't think it's because they don't know. I think it's because they don't believe that pregnant people should have these equal rights. And by not passing anything that protects that, that's what they're telling the American people.
Well, I want to thank you all for your time today. You all received in our presser contact information. For more information, please don't hesitate to reach out to the respective organizations. And again, thank you for your time.